At the beginning of the 20th century, Paul Ehrlich proposed the idea of a magic bullet, or Magische Kugel. Maybe that was right? It was a compound that selectively targets a disease-causing organism. His work eventually led to an effective syphilis treatment by 1910. In the 1970s, the B-cell cancer multiple myeloma was known, and it was understood that these cancerous B cells all produce a single type of antibody. In this sketch, we're going to be introduced to antibodies that are used as anti-cancer drugs like Rituximab. If it ends in mab, it's an antibody. In 1975, Georges Kuhler and César Milstein succeeded in making fusions of B-cell lines that would produce antibodies specific to any antigen you wanted. So, when you hear the term monoclonal, it means that these antibodies are all from the same cell line and target the exact same antigen. That M in mab means monoclonal. And then, a bit later in the 80s, Greg Winter pioneered techniques to humanize monoclonal antibodies. In other words, their protein sequences were modified to increase their similarity to human proteins. So, you might see something called a humanized IgG molecule like alemtuzumab. If something is chimeric, on the other hand, it still retains protein fragments from another animal species from which the antibody was derived. Today, a wide array of humanized and chimeric antibodies are available, designed with specific therapeutic targets in mind. This includes antigens found on cancer cells. Many antibodies available are specific for hematologic malignancies. In other words, we're going to be taking down malignant B cells and T cells, represented as always by those white antibody archers and cytotoxic T cell crusaders. So get ready, because we're going medieval on this one. This coronation ritual is going to represent our first anti-tumor antibody, Rituximab. Think of it as a Rituximab ritual. Let's go through a few of those terms we described earlier. It's got that mab suffix, so we know it's an antibody. More specifically, it's a chimeric monoclonal IgG. The fact that it's chimeric is made quite clear by that chimera insignia there, emblazoned on his opulent velvet cape. A chimera is a Greek mythological hybrid creature. Similarly, Rituximab is kind of like a hybrid. It's part mouse-derived, its variable region is actually the part that binds antigens, and it's part human-derived. This distinction will become important once we discuss side effects. Rituximab targets CD20, a cell receptor found on the surface of B cells. At Sketchy, B lymphocytes are represented by white antibody archers. And you see how the archer on the left there is getting pulled down as the others show their respect and bow to the king? Rituximab depletes B cells by binding to the CD20 antigen on the cell surface, activating a complement-dependent cytotoxicity. Not only that, it mediates cell killing through an antibody-dependent cellular toxicity. In other words, Rituximab attaches to that B cell, labeling it for apoptosis. A natural killer cell comes by and bam! Down goes your B cell. Also, take a close look at that B cell archer getting grabbed. The two X's are meant to remind you of the number 20, as in CD20. This surface receptor is present not just on normal B cells, but malignant B lymphocytes as well. Rituximab, therefore, is used to treat CD20-positive non-Hodgkin lymphomas and other diseases related to excessive B cell function. Combined with other chemotherapeutics, Rituximab is also approved for the treatment of chronic lymphocytic leukemia, or CLL. Lymphocytic leukemia means an abnormal proliferation of non-functional B cells and T cells, depicted by the abundance of B cell archers and killer T cell crusaders on this tapestry above. The chronic part? Well, that's evoked by the frayed or chronically worn edges. B cells are also believed to play a role in the development and progression of rheumatoid arthritis, or RA. See that lantern we've sketched in above our Rituximab coronation ritual? The design should remind you of a joint, and not only that, the flame sitting inside should remind you of the inflammation associated with RA specifically. The foundation of long-term therapy consists of disease-modifying anti-rheumatic drugs, or DMARDs, including methotrexate, sulfasalazine, hydroxychloroquine, and biologics such as TNF-alpha inhibitors and rituximab. These agents inhibit the proliferation of the immune cells responsible for the chronic inflammation and long-term joint destruction that eventually leads to disability. Rituximab is usually used in combination with methotrexate for patients with moderately or severely active RA that has not responded adequately to other therapy. In fact, B-cell depletion plays an important role in the management of numerous rheumatic and autoimmune conditions, including microscopic polyangiitis and Wegener's granulomatosis, hence the torn autoantibody lantern. You know, all this talk about depleting B-cells, there's got to be an increased risk of infection, right? Well, it turns out that immunoglobulin levels don't really change that much, actually. Though repeated courses of therapy are associated with an increasing risk of depleted immunoglobulins. There is also a late-onset neutropenia that can occur in rituximab-treated patients, leading to a higher incidence of infections. Rituximab therapy also carries a risk of hepatitis B reactivation. So we've included our recurring immunosuppressed cane symbol just for good measure. Rituximab has also been associated in rare cases with progressive multifocal leukoencephalopathy, or PML. PML is a deadly demyelinating disease of the central nervous system caused by a reactivation of the JC virus that occurs almost exclusively in immunosuppressed individuals. It's a multifocal process limited to the white matter, kind of like the multifocal patchy white laurel leaves donned by our once and future king over here. Check out our Julius Caesar JC virus sketch in our Sketchy Micro course for more info on PML. One of the most predictable side effects of rituximab is a constellation of symptoms that occurs within the first hour or so. Patients may present with headache, fever, skin rash, pruritus, dyspnea, mild hypotension, and even some swelling. It's all represented here by this pink, swollen, and overtly chubby cherub. These are the classic signs of an infusion reaction, seen in over 50% of patients on their first exposure to the drug. See how he grabs onto that IV? It's our recurring symbol for IV administration, of course, and it should remind you that these are acute symptoms seen after infusion. The majority of these infusion reactions are thought to be related to an antibody-antigen interaction between rituximab and CD20 on lymphocytes. Resulting in cytokine release from these cells, it's usually managed with antihistamines, acetaminophen, or NSAIDs. Alright, let's move on to the next... What in the house of Lannister? Poisoned? But who? Did you... Wait, I think I also... Oh, no wait, false alarm. My drink's right here. I didn't drink any yet. Whew... While more immediate infusion reactions can occur within minutes, rituximab can also cause a more delayed systemic reaction that occurs within 7 to 10 days. It's called serum sickness, and it's caused by tissue deposition of circulating immune complexes. That's a type 3 hypersensitivity reaction for those of you keeping score at home. I want you to think of the delayed onset of a poison coursing through the circulation and not taking immediate effect so that the murderer or murderess can get away. Yeah, I'm looking at you, Lady Tyrell. Symptoms include fever, rash, and arthralgias that begin 7 to 14 days after exposure to the antigen. Proteinuria and lymphadenopathy can also be seen. Remember, rituximab is a chimeric antibody, part human, part mouse. Serum sickness occurs because of the patient's own immune system targeting the non-human fragments of antibody, causing immune complexes to form. Patients usually respond to pulse steroid therapy in 24 to 48 hours. Our next anti-tumor antibody, cetuximab, will be embodied by the tusks of this majestic elephant, a gift from King John, ruler of the Oats Kingdom to the east. Cetuximab is a human-mouse chimeric monoclonal IgG that targets epidermal growth factor receptor, or EGFR. EGFR should remind you of the letters found in the word giraffe, so we've embroidered an ornate giraffe pattern on the elephant's blanket. EGFR is overexpressed in a number of solid tumors, including colorectal cancer and squamous cell head and neck cancer. Activation of the EGFR signaling pathway results in uncontrolled growth, proliferation, metastasis, and angiogenesis. EGFR functions as a tyrosine kinase receptor specifically, so dangling from that saddle sitting atop the cetuximab elephant like a pair of stirrups is our recurring symbol for tyrosine kinase, a tire swing. And because cetuximab is effective in the treatment of solid tumors such as colorectal cancer and squamous cell carcinoma, let's sketch in our recurring cracked cancer crab symbol. It represents the theme of this unit, really. Look for it in every sketch, just a little reminder that we're talking about chemotherapeutics here. Due to the abundant expression of EGFR in the skin, cetuximab can cause acneiform skin eruptions, so let's color in the spots on these giraffes a nice pustular red. I also want to emphasize that all the anti-tumor antibodies in this sketch can cause that immediate infusion reaction we talked about, embodied by that pink edematous cherub grasping onto that IV line. With cetuximab specifically, infusion reactions can occur in up to 25% of patients, usually on the first exposure to the drug. The reaction includes flushing, urticaria, rash, and fever within about an hour of administration. Again, it's thought to occur because of antibody-antigen interactions resulting in cytokine release, so it's usually managed with antihistamines, acetaminophen, or NSAIDs. Oh shoot! The elephant! It's drinking... Oh no. Cetuximab is a chimeric human-mouse antibody, hence the XI in its name. So it has the potential to cause that dreaded serum sickness we talked about earlier. This delayed type 3 reaction, however, has mainly been reported with rituximab, so keep the latter drug in mind on the exam. It's her! The Queen of Thorns! Disguised as a chef? I knew it! Who am I kidding? I'm just gonna come out and say it. I have no idea who that is. I literally have to keep like a Wikipedia page open or something whenever I watch this video. So many twists and turns, and unnecessarily gratuitous nudity. I get confused. Anyway, this medieval barista preparing that beverage in the back there, she's going to represent bevacizumab, an IgG monoclonal antibody that binds to the vascular endothelial growth factor, or VEGF. Whenever we want to convey inhibition of VEGF specifically, we'll include some chopped up VEGF vegetables like the ones stacked up on the kitchen table here. Bevacizumab directly binds to VEGF and prevents it from interacting with its receptor, especially on vascular endothelial cells. Thus, it functions as an anti-angiogenic drug, inhibiting the growth of blood vessels in tumors. Just think of these vascular-looking carrots here getting chopped up, evoking an image of inhibited angiogenesis. This can actually impair wound healing in a variety of settings. Patients should wait at least a month before starting bevacizumab after surgery. Because of its anti-angiogenic action, bevacizumab is useful for treating certain metastatic cancers such as colon and lung cancer, hence our recurring cracked cancer crab. Not only that, inhibition of angiogenesis comes in handy when managing wet macular degeneration. See that leaky beverage being carried on that retina-evoking pillow? On ophthalmic examination, wet macular degeneration can be seen as grayish discoloration of the macula with areas of adjacent hemorrhage, kind of like the hemorrhagic spill here. Age-related macular degeneration is the leading cause of blindness in industrialized countries. It's classified into dry and wet subtypes. Wet is characterized by retinal hypoxia, which stimulates local VEGF production and causes subretinal neovascularization with formation of leaky vessels. This causes an acute loss of vision over days to weeks. Wet macular degeneration usually requires treatment with VEGF inhibitors like ranibizumab and bevacizumab. Let's talk side effects. Bevacizumab has been demonstrated to increase the risk of bleeding. Most commonly, this manifests as epistaxis, but take a look at the gratuitous amounts of, what is that, bee juice? I hope? On those aprons. It turns out that serious and in some cases fatal hemorrhagic events can occur, including hemoptysis, GI bleeds, hematemesis, and intracerebral hemorrhage. Bevacizumab and other similar anti-angiogenic agents have also been associated with an increased risk for arterial thromboembolic events. Hence the thrombotic ice cubes floating in our anti-angiogenic beverage there. These thromboembolic events are potentially fatal and include TIAs, strokes, angina, and MI. Another infrequent but potentially fatal toxicity of bevacizumab is gastrointestinal perforation. It's depicted here by this intestinal-looking sack of vegetables perforated and spilling produce on the castle floor. GI perforation has been reported most often in the setting of metastatic colorectal cancer and epithelial ovarian cancer. It can lead to fistula formation, intra-abdominal abscess, or peritonitis requiring emergency operative intervention. So, when your patient develops an acute abdominal pain while receiving bevacizumab, even if they have no apparent risk factors, keep GI perforation in mind. Let's head to the back of the castle where a little skirmish is developing between an uninvited peasant and a few of the guards.
Ohms for an ex-leper? Spare a talent for an old ex-leper? Come on, big nose, let's haggle.
Alemtuzumab is an IgG monoclonal antibody that binds to CD52 found on normal and malignant B and T lymphocytes as well as natural killer cells and monocytes. Again, B and T cells are represented by our recurring white antibody archer and killer T-cell crusader. If you take a close look at the pattern inscribed on the sheath he latches onto, you'll see an intertwining pattern of 5s and 2s to remind you of the CD52 cell surface receptor found on mature lymphocytes. On binding to CD52, alemtuzumab initiates a direct cytotoxic effect through complement fixation and antibody-dependent cell-mediated cytotoxicity. Alemtuzumab's ability to deplete lymphocytes has proven useful for the treatment of chronic lymphocytic leukemia. Again, CLL is represented by this chronically worn tapestry depicting an overabundance of B-cell archers and killer T-cell crusaders. In the setting of depleted lymphocytes, there are numerous adverse events you need to watch out for, including bone marrow suppression, infections, and even the emergence of autoimmune disorders. Regular surveillance for these possible side effects is required. Alright, let's wrap up this monoclonal coronation ceremony with our last anti-tumor agent, trastuzumab, a monoclonal antibody used in the management of patients with HER2-positive breast cancer. Trastuzumab will be represented by the woman here working the loom. Think trastuzumab tapestry. Many breast cancers overexpress epidermal growth factor receptor 2, or HER2, a transmembrane glycoprotein with tyrosine kinase activity. Tyrosine kinase is, again, represented by our recurring symbol, a tire swing, this time serving as a rocking cradle for her babies, HER2 babies. Yeah, that just happened. Trastuzumab is a monoclonal antibody against HER2 that is used in patients with HER2-positive tumors. It inhibits MAPK and PI3K-AKT signaling pathways, increasing degradation of HER2 and facilitates antibody-mediated destruction of tumor cells. HER2 is overexpressed in 20% of breast cancers and also in adenocarcinomas of the ovary, stomach, lung, and salivary glands. Breast cancer specifically is depicted by the bilateral cancer crab design incorporated into the front of her dress. In breast cancer, HER2 overexpression is often associated with aggressive tumors, though it does predict a therapeutic responsiveness to trastuzumab. Other markers are used to predict tumor response as well, including estrogen receptor and progesterone receptor positivity. If the breast cancer is estrogen receptor positive, for example, the tumor may respond to anti-estrogen therapy such as tamoxifen. Patients should also be monitored for potential cardiomyopathy while taking trastuzumab. Take a look at the fraying end of that trastuzumab tapestry and you'll notice an eroding heart design. Trastuzumab-related cardiotoxicity is most often manifest as an asymptomatic decrease in left ventricular ejection fraction and less often as clinical heart failure. Luckily, this effect is often reversible with treatment discontinuation. Alright, let's sum up this whole sketch before this gets bloody. Rituximab, embodied by that coronation ritual, is a chimeric monoclonal antibody that targets CD20 on the surface of B cells. This drops your B cell counts, just like these B cell archers dropping to one knee. Rituximab-mediated B cell depletion is important not only for treating B cell lymphomas, but also for various rheumatic and autoimmune conditions. All of the monoclonal antibody drugs in this sketch are associated with infusion reactions due to cytokine release, which include headache, fever, skin rash, swelling, and dyspnea within hours of administration. This is depicted by the swollen and overtly chubby cherub at the top of the scene grabbing onto that ivy. Serum sickness, on the other hand, is a type 3 hypersensitivity reaction caused by chimeric antibody agents, especially rituximab. This is a delayed systemic reaction that occurs within 7 to 10 days, kind of like the delayed onset of that poison. Cetuximab, symbolized by a pair of majestic elephant tusks, targets EGFR, a receptor tyrosine kinase. Hence the tire swing in front of the EGFR giraffes. Cetuximab treats solid tumors such as colorectal cancer and head and neck cancer. Watch out for that acneiform rash shown by the red dots on the giraffes. Bevacizumab, embodied by the beverage makers, binds VEGF, which inhibits the growth of blood vessels and tumors. Hence the chopped up vegetable with roots like branching blood vessels. Bevacizumab is used to treat solid tumors as well, but also wet macular degeneration shown by the wet retina pillow carrying the beverage. VEGF inhibitors can also cause hemorrhage, blood clots, and GI perforation. Alemtuzumab, the beggar asking for alms, binds to CD52 on those B-cell archers and T-cell knights. This helps to deplete lymphocytes in CLL treatment. And finally, trastuzumab, the tapestry weaver, a monoclonal antibody against the epidermal growth factor receptor HER2, which also happens to be a receptor tyrosine kinase, hence HER2 babies in her tire swing. Her crab bra reminds us that HER2 is overexpressed in certain breast cancers, and lastly, watch out for cardiotoxicity. Well, that about does it. See, anti-neoplastics aren't that bad once you get to know them. I bid thee farewell.
Arms for an ex-leper. Arms for an ex-leper.
Oh, shoot, here comes that beggar guy. Just don't make eye contact.
Alright, 2 shekels, just 2. Isn't this fun, eh?
Here, just take this.
Half a denarii.
Ugh, there's no pleasing some people.